my channel. My name is Summer and I'm an online reseller. Today's video is not going to be about reselling. I'm going to be giving everyone an update on how I have been doing post knee surgery. This has been my third knee surgery within the past year. I will link my video up above of the story of why I've had 3 knee surgeries in the last year and what happened to me. I'm not going to get into it in this video. So if you want to go back and hear the whole story, I'm going to link that up above. But to give you kind of a short story of this knee surgery, just kind of recap that. I had knee surgery on my patellar tendon, and they basically had to go in and cut away like bad tissue in the tendon where it was just damaged. It had like scar tissue on it. It was inflamed, that kind of thing. It had thermal damage, so they had to cut away that tissue on the tendon and sew the tendon back together. This knee surgery was a lot harder than my other two. The other two were arthroscopy surgery, so it was a little less invasive. This one was a little bit more invasive, so my recovery has been a lot tougher. It's going to take a long time, considering everything that I've been through to recover, and so yeah, it's just going to take a lot of time. I've had a lot of muscle atrophy from being kind of bedridden almost for the past year, not really using my leg because of everything that happened and all the knee surgeries that I've had. But I am doing good. I saw my surgeon last Wednesday, and he says that everything's looking pretty good considering what all I've been through, and that it's just going to take more time, and I'm just gonna have to work, extra hard during PT and at home with my exercises. They have me on a schedule of doing exercises to strengthen my muscles, my knee, and to get the bend back. I'm doing those 2 times a day at home, and I'm going to physical therapy 2 times a week at their office. So I am off my crutches since last Wednesday, which is good. It still does hurt to walk. I'm not able to walk a long time before I have to sit, but I am doing pretty well with that. So I'm happy about that, because I've actually been on crutches for the past, 4 or 5 months, which has been pretty annoying because you can't do much when you're on crutches. So I'm going to link some photos here on the screen to kind of let you know, or let you see how my leg looks, the swelling, the incision, that kind of thing. Everything's looking pretty good, but as you can notice in the photos that I'm sharing, I do have some color change between each leg. My leg that I had surgery on versus my good leg. The leg that I had surgery on, it looks a lot redder, my skin shade, and like I had mentioned in my previous video on my story, the reason why I have that color change is because I'm having some type of sympathetic dysfunction within my nervous system because of all the trauma that was done and the damage that was done inside of the knee during my first surgery. So it's kind of pretty much caused my my nervous system to kind of be out of whack and not really know how to work properly in that area. So basically my skin changes to a brighter red. It gets really hot and inflamed when I do too much on it, and it can be very painful. So that's kind of hindering my recovery a little bit also. At first, they kind of wanted to diagnose me with what's called complex regional pain syndrome, or it's also called reflex sympathetic dystrophy. And like I had mentioned in my previous video, that is a very painful disorder that can happen sometimes after an injury or after surgery on a limb, and it could be a quite devastating diagnosis for people. So they wanted to originally diagnose me with that, but I'm seeing a specialist that has now said that he doesn't want to diagnose me with that quite yet because I don't really have the full-blown symptoms of someone that has that. He's really hoping that the trauma from the surgeries and what happened inside the knee has caused what he's calling a sympathetic dysfunction. And he's hoping that once I recover from my surgery that all those symptoms go away, which I'm hoping and praying that that is the case, and I will be back to normal soon. So I had physical therapy today, and he said everything is looking great. My bend is, you know, better from the last time, and everything seems to be on track. I'm still gonna have to work super hard at home and to get my muscles built back up, and hopefully soon, maybe in a month or two, I'm hoping that I will be, you know, on my way to being back to normal, because it's been a year. I had my first surgery in March of 2020, and I've, like I said, been kind of down, you know, since then. So I had my first surgery last March, my second surgery last October, and then this last surgery in March of this year. So it's been a long road. I thought I would give you guys an update on how I've been doing, and I hope to, in about a month, maybe give you guys another update. So thank you guys so much for watching, and I will see you in the next video. Thanks, bye.